Hi, I'm Dr. Frederick Ehlert. The following informational video, provided by St. Jude Medical, will offer you more information about heart failure. It will cover symptoms, diagnosis, and treatment options. Heart failure is a large problem in the United States, affecting between 4 and 5 million people, half of whom are over the age of 65. However, there are multiple treatment options available to help reverse the effects of this deteriorating disease. Heart failure occurs when the heart is unable to contract or relax properly, leading to an increasingly ineffective heart, as its ability to pump blood is lessened. As heart failure progresses, the body attempts to compensate for it by increasing the size of the heart so that it can pump more blood to the body. This is also called remodeling. While the remodeled, enlarged heart initially pumps more blood, it eventually requires more oxygen than is available, resulting in further damage and decreased pumping efficiency. In addition, heart failure can keep the kidneys from adequately ridding the body of fluids. Heart failure has many causes. Coronary artery disease affects about 50% of patients who suffer from heart failure. Other causes include high blood pressure, arrhythmias or abnormal heart rhythms, heart valve disease, congenital heart disease, and diabetes. Frequently, the cause is unknown. The symptoms of heart failure include general fatigue, shortness of breath, and severe swelling, especially in the legs and ankles. Your doctor may use various techniques to diagnose heart failure, including taking your medical history, conducting physical exams, and running diagnostic tests, such as an electrocardiogram, chest X-ray, or echocardiogram. Heart failure typically is treated with changes in lifestyle and a combination of medications, which tend to be more effective when the disease is in its earlier stages. However, advanced heart failure may require more invasive techniques, such as external counterpulsation, cardiac resynchronization therapy, a left ventricular assist device, or even heart transplant. During external counterpulsation, pressure cuffs on the legs are inflated in sequence. As a result, the blood vessels in the legs are gently compressed and the blood is forced back to the heart. This routine is performed over a period of several weeks, with each session lasting from 1 to 2 hours. Cardiac resynchronization therapy, or CRT, delivers electrical impulses to the heart's 2 lower chambers and one of the heart's upper chambers. This is called biventricular pacing, and it causes both ventricles to beat at the same time. CRT is administered using a pacemaker called a CRTP, or an implantable cardioverter defibrillator, also called an ICD. The device is implanted just like a standard pacemaker or ICD, except that a third pacing lead is added to help stimulate the heart's left lower chamber, or left ventricle. A left ventricular assist device, or LVAD, is a mechanical pump that helps the heart to beat normally when it cannot do so on its own. Most patients using an LVAD are awaiting heart transplant. Heart transplant is often a last resort treatment and involves replacing the failing heart with a live, healthy heart. Transplants are performed in only about 1% of patients with advanced heart failure due to the scarcity of donor organs. This video was created by St. Jude Medical to provide information about heart failure. This is not a substitute for medical advice. If you have questions about a heart condition, please talk to your physician.